Students, today's topic is dental auxiliary. Dental auxiliaries, others known as dental manpower. So, in your university exam, so many times ask dental manpower or dental auxiliary. So, as purpose exam, this topic is very important. They ask as a LAQ or short question. So please carefully listen. In dental auxiliary, contents are introduction, definition, classification, various dental auxiliaries, benefits of auxiliaries, degrees of supervision, factor influencing dental auxiliary, Indian scenario, dental manpower planning, conclusion. First, what is mean by dentist? Huh? You are a dentist, but exact meaning is what? Dentist is a person which is licensed to practice dentistry under the law of appropriate state or nation. If there is not license, dentist couldn't be practiced. So license is important. Dentist must be both licensed and registered. To become a licensed, a prospective dentist must satisfy certain qualifications, such as first is completion of appropriate period of professional education in approved institute. Who is become licensed? Those are the completion of approved period of professional education in approved institution. And second is a demonstration of competence. The dentist, along with the auxiliary, comprise the oral health care team. Only dentist is a oral health care team? No. Dentist, along with the auxiliary, it is oral health care team. Which auxiliaries? First, histories of dental auxiliary. Operates in defining the ideal state, gives a prerequisite that means should divide labor. Certain men become expert in certain field, other field, and all working as a team for common good. 1723, Orchards, a French surgeon, is known as the father of modern dentistry. In 1924, the first dental college of India was established in Calcutta by Dr. R. Ahmed. Please listen because this sentence asked for MCQ. In 1924, first dental college of India was established in Calcutta by Dr. R. Ahmed. In 1933, the Nair Dental College and Hospital. In 1938, Government Bombay, in Bombay established. Prior to 20th century, the dentist employed men and boys to help them in their dental practice. In 1885, Dr. C. Edmund Cale of New Orleans, Louisiana, hired a female to replace a male assistant. In 1887, the case mentioned the lady in attendance in a paper published in Ohio Journal of the Dental Science. Dr. Pons coined the term, listen, Dr. Pons coined the term dental auxiliary in the year 19th century. By the early 19th century, the sign denoting the lady in attendance were the common in dental office windows. In 1911, Dr. Henry Fowler of New York City hired Juliet Southard as his the permanent assistant. Dental assistant societies were organizing throughout the country, the first in Nebraska in 1970. The ADA incorporated on March 17, 1925 in Indianapolis. Within the membership, no distinction is made with respect to chairside assistant, receptionist, or general assistants. Due to shortage of labor to meet the demand of the military service during the World War II in 1939 to 1945, the helpers were trained to work at their chairside. These dentists retained the concept of the auxiliary utilization after the war. In 1947, certifying board was established as separate and the autonomous agency responsible for testing and qualified dental assistants for certain and right to use the CDA after their name, and it was a 104 hours course. The Dental Assistant National Board can also qualify for the Certified Dental Practice Management Assistant, Certified Orthodontic Assistant, Certified Oral and Maxillofacial Surgery Assistant. There was a mark to change during the 16th with the advent for four-handed sit-down dentistry. The term four-handed dentistry The term four-handed dentistry is given to art of sitting both dentist and dental assistants. Dent- Dentist to hand and dental assistant to hand. That is mean four-handed dentistry in a such a way that both are within a easy reach of patient's mouth. Dental auxiliary is a generic term. Dental auxiliary is a generic term for all person who assist the dentist in treating the patient. In Britain, they have been known as a dental ancillaries. The word, the word auxiliary means being helpful, subside. As early as in late 19th century, the dentist in his practice of dentistry taught assistant over the year of the different curriculum and the function. there has been a change in the nature and scope of those who directly assist the dentist and those who deliver the dental care. In different countries differ in number and type of auxiliary use. The studies have shown that addition of dental assistants has resulted in increases the number of patients that can be treated. The auxiliary can play an important role in dental health of the community. Now coming to the definition. Dental auxiliary is a person who given a responsibility who given a responsibility by dentist so that he or she can help the dentist render dental care, but who is not himself, listen, but who is not himself or she qualified with the dental degree. What is function? Only he or she can help the dentist under the supervision. Duties undertaken by auxiliary range from simple tasks such as sorting instruments to relatively complex procedures which form part of the treatment of patients. It is a person who gives another definition by Slack. Dental auxiliary is a person who given responsibility by dentist so that he or she can help the dentist in the dental care, but who is not himself or herself qualified with a dental degree. The duties undertaken by dental auxiliary range from the simple tasks such as the sorting instruments. In Britain, dental auxiliary have been known as a dental auxiliary since 2002. General Dental Council has adopted the term professional complementary to dentistry. The word auxiliary means being helpful, subsidiary, whereas the ancillary means subservient, subordinate. Now we come to classification of dental auxiliary. These are variety of ways in which dental auxiliary are classified. Example, according to task, training, legal status. According to WHO classification, a conference held by WHO in New Delhi in 1967 suggests, suggested the following classification. First is a non-operating auxiliary. In, in that, there are two types. First is a clinical and second is a laboratory. In clinical, this is the person who assists the dentist in his clinical work but do not carry out any independent procedure in the oral cavity. In a laboratory, this is the person who assists the dentist by carrying out certain technical laboratory procedure. In operating auxiliaries, it is the person it is the person who not being a professional is permitted to carry out certain treatment procedure in mouth under the direction and supervision of professional. Operating auxiliary means it is person who not being professional permitted to carry out the certain treatments in patient mouths under the direction and supervision of professional. According to revised classification, in a non-operating auxiliary, dental surgery assistants, dental secretary receptionist, dental laboratory technician, and last is the dental health educator. All these are the non-operating auxiliaries. And in the operating auxiliaries, first is a school dental nurse, second is a dental therapist, third is a dental hygienist, and last is the expanded function of dental auxiliary. There are two types. First is operating and second is a non-operating. In operating, dental school dental nurse, dental therapist, dental hygienist, expanded function of dental auxiliary. In operating is dental surgery assistants, dental secretary, dental laboratory technician, dental health educator. Now coming to the non-operating, first is the dental surgery assistant. Dental surgery assistant is a non-operating. Is a non-operating and to assist the dentist or hygienist in treating the patient. And it is not legally permitted to do the work in patient's mouth. Dr. C. Edmund Gates of New Orleans, the lady in attendance. Then, dental surgery assistants, it is non-operating and role in to assist the dentist or hygienist in the treatment patients, but who is not legally permitted to treat the patients independently. The employment of women, the employment of women as a dental assistant was started in USA more than a century ago. Dr. C. Edmund Gills of New Orleans employed a woman as a lady in attendance. Who is Dr. C. Edmund Gills? In 1885, in 1885, so that ladies who needed the dental treatment were made to feel at ease. This practice became popular. The utilization improved during the World War II due to acute shortage of the professional to meet the demands of armed forces. The dental assistants perform certain tasks which are non-technical in nature and do not require much training. Coming to the four-handed dentistry, the term four-handed dentistry is a given to the art of sitting both dentist and dental assistant in a such a way that both are within easy reach of patient's mouth. Easy reach of patient's mouth. The patient is in fully supine position. The assist will hands the dentist are particular instruments he needs, and she will also perform additional tasks such as retraction or aspiration, retraction, the cheek. So see this picture, role of the four-handed dentist. Two hands of dentist and two hands of assistant become a four-handed dentistry to easy reach to patient's mouth and Advantage is for and coming to advantage. Advantage is reduced physical and mental strain of the operator. The improved quality of service. Next is appointment period also may be shorter. The WHO has listed the WHO has listed the duties of dental assistant as follows. These are the duties of dental assistant, dental surgeon assistant. First duties is the reception of the patient. Reception of patient. Next is the preparation of the patient for any treatment he or she may need. Preparation of the patient for any treatment. Preparation and provision of all necessary facilities such as mouthwashes and napkin. Next duties is sterilization, care and preparation of the instruments. Next duties is the preparation and mixing of the restorative material including both for filling and impression materials. Next duties is care of the patient after treatment until he or she leaves the including clearing away of the instruments and preparation of instruments for reuses. Preparation of the surgery for next patients. Preparation of documents to dentist for his completion and filling. Dental assistance helps in instruction to X-ray work and processing and mounting of X-rays. Instruction to patients regarding the correct use of the toothbrush. Care of the patient, offer treatment and offer general and anesthesia. All these are the function of dental surgery assistants. Now coming to the dental secretary or receptionist. Dental secretary is a person. See this picture. You understand the role of the dental secretary. Dental secretary is a person who assists the dentist with his secretary work and patient reception duties. Now next is a dental laboratory technician. Dental laboratory technician is a non-operating auxiliary, which is who fulfill the prescription provided by dentist regarding the extraoral construction and repair of oral appliances and bridge work. See, these are the laboratory technician. As per the Indian Dentist Act of 1948, dental mechanics is a person who makes or repair of denture and dental appliances. In UK, in UK, the dental laboratory technician become a distinguishable from the dentist in 1921 after the Dentist Act has been passed as a law. This was in line with the recommendation of WHO Expert Committee on Auxiliary Dental Personnel. The dental laboratory technician receive their training through apprenticeships which which is sometimes associated with the formal training at the dental school and technical colleges. The formal training period goes as much as 2 years. In India, there are about six dental institutions where training course exists. The denturist is a term. The denturist is a term applied to those dental laboratory technicians who are permitted in some states in USA and elsewhere to fabricate the denture directly for patients without dentist prescription. So these only occurred in USA. So dental laboratory technician means the denturist. They may license or register. The ADA defined denturist as the fitting and dispensing of the denture illegally to public. In Denmark, uses the term denturist to describe the special category of dental technician who sits at an examination to the enable him to prescribe, make and fit the removable denture without the supervision. The ADA has vigorously opposed the denturist movements at a political level. Next, coming to the dental health educator. It is the person who instruments in prevention of dental disease and who may also permitted to apply the preventive agents intraorally. In few countries, the duties of some dental surgery assistants have been expanded to allow them carry out certain preventive procedures. See, dental health educate to educate the people regarding the health. These are the instruct and educate